questions in the lobby with Dina and Robbie.
Wonderful receptionist. We still got to come out in front and do that. No, not gonna happen.
Do you have any? You still have that one viewer, 2, maybe 3. Average view time is 51 seconds. And they just leave. Well, it is a little. But we're very well liked in real life. So I don't think that you should be upset about the virtual life.
This is true.
It is. And really, like, our YouTube channel's like this big. So and it just, you probably shouldn't make, that's what she said, jokes. Hold on, Mike's texting me again. Just a splash screen.
What?
You can't get it.
Oh, maybe that's why we have 3 viewers. That would make me feel better.
Alright, reloading. Hold on, I'll call you. Let's do that. Since Mike's the only one listening, we could probably just do what?
Why did you do that?
I don't know, because that's a whole other thing. And you still have to use the same streaming software to pair with it. It's a pain. So you can't see any of it?
No, I mean, I heard y'all earlier.
Really? Can maybe like reload the whole thing? Like close your browser and open it back up?
Oh,
Because like you got lots of phones and
doing
stuff happening. Right
However, wait a minute, wait, they're on and you can't see it.
what do you mean?
Like you can't see the number of, never mind.
Oh no, they can't see it. Those are our analytics. We wouldn't want
I know, but I was looking that they're watching and we are.
Mike's with us too, everyone. He's just on this phone.
There's 2 links.
There you go.
There's 2 links. One that's working and one that's broken.
It's a good thing you're pretty.
Yeah.
You're up on the desktop as well.
Yeah, so there you go.
Yeah, so there's one that's just got like this blue splash screen.
Yeah, and that was one of my screw ups. So just add that to the list. And we'll go over that during evaluations.
I feel like you say we have evaluations, but we don't. And I would like to say that we're not normally this goofy,
No.
but we are.
It's
a good, yeah.
What? No. You kind of broke up a little bit.
That's okay.
Mike, why don't you do me a favor and go ahead and copy the good link and post it on Facebook and say, hey, we're waiting on some questions or something.
Yep, let me do that.
And we'll see if we can't get some real people to ask some questions.
I see his question coming through. Well, his test question.
My test question?
He said that you might restart his test.
Oh, really?
What I gotta figure out how to do is to share the link. I'm gonna copy it and I'm gonna post it as the client now.
Yeah. We have 4 viewers, what it shows right now, I think.
However, I feel like that's all of us.
Which I think is all of us.
But we support each other.
And we do support each other. And, we're probably getting some crazy, insane footage that I can edit later on.
Oh my God, this would be great. Reserved bloopers.
I should have, put several cameras up. I made that work. That would have been funny.
We should have someone wear a GoPro one day, just all day.
I wanted to put a GoPro on bugs and have it like how the dog's view
Oh, that would be so cool.
of like coming into the clinic and hey, who's little Gary, hi, and then like running in and going, and then we could pretend like somebody's like intubating her, and then underneath the drape, and then she wakes up and there's like pink elephants and purple monkeys, and then she comes back for rehab, like.
The way you make that really good, though, you want me to tell you?
Not
Because
enough.
GoPros really aren't that great.
No, you said something else.
Yeah, so I'm just the dog, I get to be the dog, and I go around with a very little camera, and then y'all treat me like a dog, like you usually do.
You know what this is, Robbie?
You have to bark.
It's the world's smallest violin.
If it was, then it would be very, very high pitched. Like that one.
The good news is it would have matched the color of the floor. You wouldn't have known.
And the afternoon drink from now on is milkshake from Sonic.
Brought to you by.
But they didn't help pay for this promotional video? Something like that?
No, I feel like
Ron mixes all the words up. So that didn't work out so well. Hey, Mike's still on speaker. Let's change the subject. We could FaceTime and then everybody could see his face too. We hold it right here.
oh.
Yeah, you want me to FaceTime yet?
Huh?
Almost Thanksgiving or whatever that Sonic Boom is advertised.
It is hilarious. I think we did have some questions written down that we could talk about.
We did.
Brittany, where are those questions? Do you know? Are you still over there? Are y'all staying late just for the live stream? Or are y'all like
We're
do
not
this
late,
late?
but we just wanted, we're here
Lots
to
of
support.
messages.
These are ones.
Ah, thank you. So our first question.
You should have a pipe next time. Like Masterpiece Theater.
And like,
This is why.
we could have fun
This
with
is why
this.
we don't go live that often. Is because it's just yeah, exactly.
Yeah, at the end of the day, we saw a lot of patients today. How many patients did you see today?
7.
7. That's actually a lot of patients for surgery.
I talk a lot too.
Don't all the rehabs and the drop-off.
Oh yeah, we didn't.
No,
Yeah,
we
it
had,
was just
like-
for surgery.
Yeah, that's just surgery. So we had, I think about 10 rehab patients coming today, 10 or 11.
I did get slobbered by Titus
Yeah.
and a loving by.
What was your most interesting case today? Now I'm just asking random questions.
Like,
We don't get this quality time
we
together
don't
like
get
this.
spot. No, usually we're sitting there just picking at each other.
Yeah, or hey, this thing needs to be done.
Yeah.
Or hey, Robbie, why don't you really learn about live streams before you screw them all up? But the fact of the matter is I did. I'm blaming YouTube and OSB software. That OSB software is very complicated. Not really, but I don't know. I don't know what it was.
Alright, we saw some orthopedic cases.
We did.
We saw a couple neuro cases too. We're getting like a.
Wound care.
That was
wound care
amazing.
one is pretty awesome. I
I'm
wish I could
super
just
excited
put
about
the
that.
camera onto that thing. Because, yeah, that one's going to be an interesting thing. So stay tuned for a whole Facebook video
Like,
about
this is like a
this
test
on this dog. Yeah.
feed. Oh look, 6 people.
6 people are watching. That's amazing.
I feel bad for them.
All right, so our first question is, my pug needs surgery for a kneecap issue, but I am terrified of putting her under anesthesia due to her smushed face and breathing issues. Valid point.
I have a squishy face fan.
What's the medical word for smushy faces?
Brachycephalic.
Brachycephalic. I knew she did. The breathing issues. How can I be sure that breeds like mine will be safe under anesthesia and surgery? Pretty good question.
That is a really good question. I actually get that a lot.
Do you?
Yeah,
I
because.
never talk to clients about that because that's your job.
Yeah, usually when, yeah. Well, I mean, I would think that that would be a concern in the treadmill. Is that a concern? Well, no, it's not really a concern, but people would be concerned
You
about
know,
it.
circling around, like when papers started coming out about rehab and underwater treadmills, I remember reading
Speaking
one,
of squishy faces.
and I think the first, like, there was an opening sentence, like, you know, we should never forget that death by drowning is the most, you know, worst complication that you can have. And that's really horrible, because, like, really, you're gonna let a dog drown?
Can I tell you
That has happened, yeah.
that, no, I got on tangent, we'll get back to the squishy faces.
Mhm.
That when Meatball and I went to the lab,
Mhm.
I don't know how many people were like, oh yeah, we have dogs that drown all the time. How does that happen?
Yeah. You have to be really, really not paying attention. Hey, look, we have 6 viewers and everybody's watching for 2 minutes, 37 seconds even. This is amazing.
It's probably turning on to like.
We're getting more popular by the minute. Bye, y'all. Our receptionists are leaving. We
One
love
of them has
them.
a smushy face.
One of them does have a squishy face. Well, the receptionist.
No, not the receptionist, the puppy.
But back to our question.
Okay, so alright, so the big problem that you run into with brachycephalic dogs is they honestly have the same amount of tissue in their face that a dog with a normal nose has.
That's a really good way to put it.
It's just smushed. Literally, it's a 100-yard dash and a 90-yard gym. So the problem that you run into, or the thing you worry about, is because you have all that redundant tissue, it's going to cause a lot of air turbulence when they're breathing. So kind of over years of doing this, I'm not going to say how many years, I've actually figured out that the big things that you always want to make sure of are when you're putting them under and you're waking them up. Those are going to be the two most important times, okay? So if you pre-oxygenate, so pretty much give them oxygen before you put them under anesthesia, they'll have all their tissues oxygenated. So if for a couple minutes when you're trying to put the tube in, they're not necessarily breathing normal,
Yeah.
their tissues still have a reserve. So I'm gonna do IX. So
Giant bandit. I don't think they're here to take us away.
yeah, they're actually bringing something for us.
Really?
Yeah. So, anyway, so those are going to be the two most important times. So here, what I'll actually do is 1, pre-oxygenate, 2, get everything done. My team is absolutely top-notch and fantastic at being able to get everything done in one smooth motion. And I'll actually give these guys some anti-nausea medications on top of everything so that we don't have the extra risk of them, getting nauseous and vomiting. A lot of times squishy faces have gastrointestinal problems too.
Hold on, it's an Amazon package. How you take? How you got it? Hey. We wouldn't want to lose our Amazon packages. It's a late night for Amazon, I suppose.
Yeah. He's not in one of the fancy Amazon cars though.
No, it's not. They're in everything now, I suppose. Anyway, pre-oxygenation. Does that mean that just like they're getting nasal too?
Yeah, just like, pretty much just take the tube, flow by oxygen, they love it. And then, under anesthesia, they're going to be hooked up to the same things that you or I would be hooked up to. Any dog, honestly, under anesthesia gets that. But the other thing that I do for these guys is, when you're waking them up, is you'll actually have them where I want them to where they are sitting up and chewing on that tube. Because that way they are completely awake, they know what's going on, and a lot of times these guys will sit there for an hour, hour and a half, sitting up with the tube. It's the best they've ever breathed in their life. So those are some of the extra precautions that we take with these guys.
So you want them kind of almost chewing on it because
literally
you want to
like
make sure that
sitting
all
there,
their reflexes, reflexes are working so that they can swallow, not aspirate, anything like that, right?
This is true.
Very cool.
Yeah.
Does that answer your question?
I have a squishy face dog, so
we have 10 more viewers. You know what? They like my jokes. They told their friends. I doubt it.
You're my friend.
I doubt it. Let's move on to the second question. Are there any alternative options for a CCL tear? My vet recommended a TPLO surgery, but is there anything like a brace or a treatment that avoids surgery to fix the issue?
So, no.
The short answer is no.
No.
I mean, braces and any other treatment don't fix the issue as well as a TPLO. That's just bottom line.
So, the big thing that you're running into is with dogs, in a nutshell, the ACL actually decreases any instability in the knee. The problem that you run into with a brace is unless you cast the leg, you're always going to have that instability. However, in very select and rare instances when dogs are unable to go under anesthesia or have surgery, I have done braces. But they're not like the generic ones. They're the ones that I send to you for fancy fabrication.
The only ones that I really like are from Hero. I think their website is GoHero.
So here we go.
.com. And I've been working with Ben Blakey for a long time. I actually helped him out with a lot of his media and so forth when he was opening that company. And I do believe in his brace on some level for a subset of patients, especially when they really just can't do a whole lot. But it does have its limitations, and we can't say that it stabilizes the cycle of the dog at all.
No.
I mean, there's nothing that really truly proves that. It does seem to help them walk a little bit better. I did some gait 4 studies, I guess last year some, and it was only a couple of dollars, but I did see an increase in pressure on both of those cases.
I think the
So,
biggest kind of long-term thing
Yeah.
to worry about is going to be arthritis. 'Cause
Exactly.
You're still going to have the arthritis formation. Like I said,
Yeah.
I've done it in a couple cases where surgery was just unfortunately not an option, and it's better than nothing. You
Yeah.
know what I mean?
it is
but-
definitely better than nothing, but it can make it louder.
A little bit.
Louder.
Yeah. We're listening.
Might be able to change that. Let's see.
It's truly all these non-people are the people that are here.
Yeah, they're not even supposed to be here. Let's see if we can't make the microphone louder. Sound. Sound. Microphone. Ooh, it might be all the way up. Output. That went all the way up a little bit. Yeah, we can move it a little closer. We can speak up a little louder as well. Hey, look, there's all these questions that we have not been seeing either. Martha's here,
Oh,
John's
I
here,
can't even remotely read that. I'm too old.
Michael is here.
Michael better be here.
You know Michael? I'm trying to move this in a better place.
Oh my god.
You know, it's just my computer, it'll fall on the floor.
It better not.
Current viewers, 11. We have 11 people actually watching. Nobody's actually in the chat thing saying anything. Did Robbie get another milkshake? Yes, I did. I got another milkshake. It's the afternoon drink. Have research. Much better?
Thank you.
Excellent. We have people testing these things out for us constantly because we have people.
We have people.
We do have people.
Yeah. We're supportive people.
Supportive, good people. Oh, but we were answering a question.
I think we did that.
Oh, on tangents very easily.
Yeah, that's fine.
Yeah, it is kind of normal. So, you know, there are some limitations to the braces that I've seen too. I mean,
been a
your
long
braces
time.
do inhibit flexion as well. So a lot of the time they don't necessarily work if the dog is, you know, needing to get up and down, and that can be a big problem for dogs who have ACL injuries, especially if they're bilateral. Yeah. But, you know, if they're walking and active, they're probably fairly beneficial in allowing that dog to bear a little bit more weight on that leg than with
Like
that.
I said, it's better than nothing.
It is better than nothing.
However,
Doesn't change the arthritis, doesn't change the progression of arthritis over time. So as a short term for a dog who may not have a lot of time with us left, I think it works. But ones who are good surgical candidates, I would always go for a TPLO.
I would for my dog. That's what I always tell people.
And we should probably also add, like, that's our favorite type of procedure for unstable stifle. Hands down. There's a lot of different kinds out there, but in reality, that's the one that, you know, we've done the most of.
I said you asked me today how many of these I've done.
Yeah, and what was your answer, like thousands?
Pretty much.
Yeah. Dodge's mom, that, like, we did she did a surgery today on one of my older clients. Yesterday. For blending. But, yeah, that was one of the first things that she asked, like, I don't know how many of these have you seen? There's gotta be thousands. Literally
There was
thousands.
15 last week.
Mm-hmm. And it's really kind of a fun case. I mean, even though I've seen thousands of them, I still learn a little bit about them. Each one, I mean, everybody's a little
Everything's
different.
different. Yeah, absolutely.
Yeah, but the awesome thing about seeing thousands like that is that you really do start to see patterns in the recovery, and you can see, oh, well, you know, this client's not resting their dog like they should,
You
or
can
they're
tell.
not giving
You
medications.
can tell when.
You can always tell.
You can take an X-ray and
We have super medical vision to let us know. So don't lie to us. We always know that you're lying. It's true. All right, so I hope that answers that question. But I'm sure there's
With
lots of
many
sub-questions on ACL, CRCL tears. So maybe next live stream we'll have more than 10 viewers. Well, actually it's only 8 right now. We've already boarded 2 people. They've fallen off. So maybe the next time we'll have more, and we'll have more questions as well.
I'm wondering if maybe people thought that since it took a little bit of time, it wasn't coming on.
Yeah, they didn't have faith in my technological
I
skill.
have, to be honest, I
I didn't have it either.
Robbie had a moment.
I did have a moment. I did. I was a little stressed.
I know, I just sat here quietly. Did you notice that?
Yeah.
I didn't say, oh,
Dina knew exactly what to do. She's like, don't say his name.
don't say
Don't
anything.
focus and let it just happen.
Just,
Hey, we gained a viewer back. It's awesome. All right. They like our banter.
it's every day. Mike had no idea. And then Mike shares an office, and
Yeah.
he realizes this is every day.
Yeah, this is every. Oh, another viewer.
See, people like it.
If we could get 11 or 12, it would really make our day. If I have questions about, all right, what? So, question number 3. If I have questions about my pet while she is in the hospital or at home after surgery, would you prefer a phone call or an email, or is there any other way that I can ask my questions? What do you prefer?
So I will tell you this, email, I can answer at my house. So if it's like, late in the afternoon and I'm not in the clinic for some odd reason, that is something that I can answer anywhere. So if it's, like a super easy, kind of thing. The other thing is we always have somebody here 24 hours a day. So if it's something that, a technician is comfortable answering, you can call it anytime, and you'll always get somebody.
Yeah, that's true.
If it's a question about a procedure, like I said, I would probably say if it's later at night, you email. If it's during the day, I promise I will try to get back to you. The other thing I've had people do is actually message me on Facebook.
Yep.
And I'm okay with that.
Yeah, I get Facebook messages, and the majority of my clients I actually text message a lot, especially since COVID. I haven't been able to bring as many people through rehab and allow them to see
I never
everything
feel bad
going
about
on.
very much, but I feel like we essentially live together.
Yeah, and I made a social distance when I set this whole scene up. I set this scene up. I did the lights and everything. That one's about to die. I think that one's on batteries, but that's on me. So I'll just get darker and darker as things go on. Anywho, one of the things that I like to do. 11. See.
They love our banter.
We do. So one of the things that I do for clients, since I can't bring them back a lot, is I always take a little short video.
I like this.
And I end up texting them that video so that they can see what's happening, see how the dog did. And see, we just lost three viewers because I was talking about business.
Maybe it's just you.
Maybe. Anywho, that's what I do. And a lot of my clients are very, very respectful that, hey, look, I'm texting you, and they don't text me in the middle of the night or on weekends and things like that. And so as long as that continues, I'm going to continue texting clients and making sure that they get the best communication that I can give them.
I've been burnt by a couple of those times.
Yeah, a few. But, we can't just let, one bad apple spoil.
This is true. This is true.
So,
Like I said.
every once in a while, but, the other thing that you can always do if you have like a wacky, super crazy client, and believe me, there are some of those out there. The majority are great, but there are a few that need a little help. And,
This is why I would never do my own thing.
you can always just ignore their text messages until working hours if they're texting you at 12 o'clock at night or something. Anywho, our next question is, I saw your post about Feline Friday. How many cats do you see a month? Do they ever get torn CCLs or pack issues? That's a pretty good question.
The reason I'm laughing. We don't see cats very often.
No, we really don't.
We don't.
What I tell
Maybe-
people is I might see 4 a year.
You're welcome.
Yeah, and they just come from her.
But yeah, I don't see them very often. I mean, maybe 1 or 2 every couple months kind of thing.
Yeah.
But the reason I was laughing about the CCO tears is I've had a handful of cats come in with tears. However, usually they are part of what's called a deranged stifle, and I didn't make it up. I did not make that word up.
It's true.
The definition of a deranged stifle is more than 2 ligamentous injuries to the knee, and it makes it essentially like floppy and horrible.
And for
So,
those who don't know, ligaments connect bone to bone. That's their job.
so you have 2 inside your knee, which is your cranial, and then your caudal cruciate ligaments. 2 on the side, which is your medial and lateral collaterals. A lot of, athletes and football people.
Me.
But what?
I did my NCL.
Well, because think that you're 12 and ride bicycles
12.
and jump stuff and then land first in them, and we laugh at you.
Yeah, it's true. It's pretty funny. But it makes me still feel super. I fly. I learned how to fly. It's great. Anyway, let's go back.
Anyway, okay, so I rarely see like an actual like cruciate ligament without a traumatic, devastating injury like a hit by car or something like that. Mike's cat. Mike is the hospital director. I also lay claim to him. His cat started limping, Jersey.
Mm-hmm.
She was named that before I came along. So Jersey, I don't know, started limping, and of course Mike like lost it. Why is she limping? So anyway, I had to bring her to work. She tore her cruciate ligament. I have no idea why. I have no idea. I think honestly for her, she already has some ligament issues to begin with. I think that's more her.
Yeah, it might be
But
something
she did have a
underlying
CCL.
metabolic issue or
She
something.
did, yeah, and it wasn't any weird thing, like it was just that one. So she literally channeled her inner dog and blew her cruciate ligament. On her case, we did medical management because she's 16 and
Probably doesn't move around a lot at that age. And
no,
this
she
cat?
just screams. Yeah, she
just
screams a lot.
That
Yeah.
sounds terrible.
It is, especially in the middle of the night.
Not bad.
Yeah, because she'll wake up and just get lost and just start wailing.
That kind of brings a question that a lot of people kind of ask me in a way, and you know, they wonder why dogs have injuries on both knees. And there's a statistic out there. I'm gonna let you say it.
I am. So unfortunately, dogs that rupture one side have, the statistic they quote is 40 to 60. I always say 50% of the time will rupture the other one, because with dogs, it's a degenerative thing, not necessarily a traumatic thing. And I have somebody, I remember this, and I will bring this up. I had somebody, and I had this whole spiel about how dogs is more degenerative, and the healthy tissue in that ligament is slowly replaced by weaker tissue. And honestly, there's tons of research. Nobody knows why certain dogs get it, why certain dogs don't. But we know that you have this tissue that's getting weaker. So everyday activity on an abnormal ligament starts breaking it down. And then they are out doing something that normally shouldn't be an issue. Dogs should not have problems if they're running around, or like sporting dogs, or you know, anything like that. They should normally not rupture their ACL. But a lot of times you'll have a dog where they're out doing something and it's enough pressure that it ruptures that weakened ligament. So that's why it ends up being about 50% of the time. So I told this guy one time, I was like, it's about a 50% chance that this can happen to the other side. And he was like, nope, this was purely traumatic. I remember the incident, whole kit and caboodle.
I've heard that too many times.
6 months later, the guy came back. And I just sat there, and he looked at me, and he's like, you knew this would happen.
Yep. It does.
I didn't say I told you so.
I've actually seen dogs very, very early in recovery, many times like around the 4-week post-op mark of their first knee, and all of a sudden the client comes in and they're like, he is doing so much better on his knee, and I'm like, they probably ruptured the other one, because that's kind of what happens. You know, you do have a genetic factor there, and then you have an environmental factor, and you know, sometimes the environmental factor is just weight bearing more on the other limb. That doesn't mean that you shouldn't fix the first limb. It's that you should save for the second.
No, but that also brings up a good thing, is when you have a dog that actually comes in with both of them torn right off the bat. I always tell people, when you fix the second side, because with the TPLO procedure, I like to stage them about 4 weeks apart, because it gives the first side a chance to kind of recover, so that on that second side, when they shift all the way over to their first side, the first side's strong enough. However, everybody calls and they are concerned because they think the dog is recovering horribly from the second side. The thing that you see is, after the first side, both knees are bad, right? So you have a post-op surgical and a torn ACL. 4 weeks later, you'll have a 4-week post-op knee that has been recovering for 4 weeks. and then a original or immediately post out other name. And a lot of times they're non-weight bearing on that second leg because that first leg feels so good.
Exactly.
So I actually am happy when they come in.
Yeah. And
Three-legged
usually, like,
after the
around
second one.
the 2-3 week mark, most average patients they're weight bearing back on that second one too. It's just that first week or two where they have a lot of inflammation and things like that. Or at least that's my experience. But
the first side feels awesome.
yeah, exactly. So I always ask people who have bilateral, is this easier or harder than the first one? And I kind of get a 50-50 shot. Like, oh yeah, this one's so much better, and no, this one's a little bit harder.
Yeah.
So I think it's kind of patient dependent a lot as well. But I like your logic on that too. So that makes a lot of sense.
You're welcome.
Have we talked enough about cruciates? Let's see.
I don't think so.
Oh wait, yeah, we have. Do we have another cruciate question? Cruciates are like probably one of the most, that's the most common thing that we see, right? That's what I think too.
It is.
So this question
It
is,
means
my
we're just really
dog.
good at fixing them.
Yeah, it's true. And we just get better and better. So it's good. If my dog has a partially torn CCL, will it repair itself? Or does a partial tear need surgery just like a full tear? Wait, there's a third part to
The
this
third
question.
part,
What happens if I put surgery off for a year? Those are pretty good questions, actually.
what was the first one?
If my dog has a partially torn
Mm-hmm.
cruciate,
Partial's always progressive.
will it repair?
It will not.
No.
And the problem that you run into is not only do you have that degenerative thing that we were talking about before, but the ligament itself actually doesn't have a fantastic blood supply. So
Yeah.
there's really nothing allowing that tissue to heal, right? Because you need, even hyperbaric oxygen is not going to fix a partial tear.
No.
No, even,
Scaffolding and stuff like that. I wouldn't put a lot of into that.
Now, I honestly, partial or fulls, it doesn't change the treatment for me. Like I said, partial's always progressed to fulls.
There's some kind of sketchy research out there that this might help and this might help, but you really want sketchy research, or do you want something that somebody's done thousands and thousands of times and their outcome is pretty darn level and good? And if I was putting my own dog through cruciate surgery or something like that, I would go to surgery. I wouldn't be doing experiment stuff.
Yeah, no, I took my dog to surgery. I cried the whole time.
Yeah. See?
Yeah, but she's doing great now.
You're
I'm waiting for the
broad.
other
She's
side.
doing great.
Yeah, I'm waiting for the other side to go.
Lesson learned.
Yeah. So if you put surgery off, the longer you have is three things that I always tell people. One is the arthritis formation. The longer that you put it off, the faster you're going to have arthritis formation in that knee.
And can I add that one out a little bit?
Absolutely right.
Because really, I read her records, or I've read her records for many years, and one of the things that I love about reading her records, especially for cruciates, is that at every single surgery, she grades how much osteoarthritis is in that joint at the time of surgery. So she grossly looks at it, says, okay, on a scale of 1 to 10, 10 being the worst arthritis that she's seen, 1 being very little, she gets to grade it. And that grade usually fits the history of the dog. Like, the dog had a problem a year ago or 2 years ago and been sitting on it, and it's kind of waxing and waning. Well, those dogs end up with much higher scores.
And the other thing that you run into too is if you have like end stage arthritis in the knee, even if you do surgery, you're still going to have problems. You're not going to have a good outcome.
Yeah,
the more arthritis that you have.
So, I think the golden rule there is to try to fix them as soon as possible. I find that, when we go in and fix partial tears, they rehab a lot quicker, and people spend less time or less money on rehab and less time in rehab for their dog, because we caught it really quick.
Yeah. So the other two things I worry about with waiting, the meniscus.
Yep.
Right. So the longer you have that instability, the more
Yeah.
smushed the meniscus is getting.
Maybe you should explain what a meniscus is, just
So,
in case somebody doesn't know.
Meniscus, same thing like people. All right, the two little C-shaped pieces of cartilage that live inside your knee, and they act as shock absorbers.
Yeah.
And because of the attachments to the bones, it is not uncommon for dogs to injure their meniscus when they tear their cruciate ligament. So the problem they run into is the more you have that instability in the knee, the more trauma that meniscus is getting. And ultimately, if you have damage to the meniscus, that's not going to heal on its own either. And two, it will constantly be a source of irritation because it's flipping back and forth. So honestly, going in there and taking it out is going to be the only treatment that will resolve it. Third thing I worry about is the other side. Because if you have a dog that all of a sudden has a chronic side and they blow their other side, then it's
You have a dog that can't walk a lot of the time,
Yeah.
especially if they're an older dog.
Mhm.
You know, the younger ones seem to be able to deal with it fairly well on some level, but a lot of those even, they have a really hard time transitioning just from a lying or sitting posture to standing. If you can't do that, you can't walk. You know, you can try, and you can help them walk, but it ends up really reducing the quality of life. You know, so I think stability in the knees, cycles, it's a pretty darn important.
Well, it's not a
Or health
forgiving
factor.
joint. Hips are a lot more forgiving.
They are. And I always found it kind of funny that, you know, back when I started in veterinary medicine in my early 20s, hip dysplasia was
They had
that was
dysplasia back
it's
then?
like 100 years ago.
It really was.
But that was the diagnosis of choice. A lot of times it was always hip dysplasia. And everybody was worried about hip dysplasia. In reality, a lot of those dogs probably have knees.
I honestly
They
don't
had knees, they
know.
had unstable knees.
We make legs.
Yeah, we make legs.
We make legs.
put legs
No,
on
I
dogs.
have, yeah, I have a lot of dogs that'll come in that have a history of hip dysplasia, and all of a sudden they blow a knee. I always can focus on the knee versus the hips, because the knee is the one that's going to cause the most issues up front.
Mhm.
You can always address, you can always kind of milk hips until they start having, issues, and that can be another discussion at some point about
Yeah.
hips. But yeah, the majority of the time it is knees because they just don't cope very well with having any injury to the knee.
Yeah, exactly. And that kind of brings us to the next question, which is, are x-rays absolutely necessary to diagnose a CCL, or do they just rule out other problems? And I think that's kind of an interesting question, because I see a lot of dogs that are sporting dogs and they have this ongoing lameness, and many times the veterinarian that's seeing them isn't finding any instability in the knee. But what do you find with knees?
A lot of times, so even if they have like partials,
Mm-hmm.
they may still palpate stable. A lot of the times you'll get more movement if you put them, like if you bend the knee a little bit, you'll actually get more movement. The other thing is a lot of times on like very well muscled dogs like pitties and everything,
Which are very, very common to have.
yes,
There.
when they are awake, and honestly sometimes even when they're asleep, they have such good muscle tone that it actually,
Stabilize.
yeah,
You have enough pull on quads and hands.
yeah, not to stabilize it when
No.
they're doing all of their normal stuff,
Exactly,
but to
but
diagnose it,
Those
yeah.
things
So
are already there.
with that being said, a CCL, the big thing that you're looking for when you're diagnosing it is instability in the knee,
Mhm.
right? So can you move the tibia and the femur in opposite directions of each other,
Yeah.
okay? So that right there is going to be how you diagnose an ACL. Radiographs or x-rays will help support your diagnosis, and it does rule out other things, okay? So the thing that I always look for on x-rays, if I have a case where I'm like, it could be either way, big thing I'm looking for is joint effusion inside of the knee, which is inflammation, makes it look very fluffy.
Mhm.
Does it look like the tibia is actually more forward than the femur? Or what was the,
Displacement.
yes, or what was the, I taught you
Pagoda.
this. Yes.
I only know that because I'm a Star Wars nerd, and she said, pagoda sounds like Yoda. I was like, okay, got it. Isn't that what you told me? Something like that?
It's sad that that's how you remember it.
I know.
But yes, that is, yes, that
Whenever
is
you ask me, I go, what was Yoda? Pagoda.
pagoda.
And it works.
Anyway, what that is if you're looking at the knee straight on an x-ray, like just like a pagoda, right? You have on the sides of your tibia, it's like little kind of wingy things, and that's going to be arthritic changes along the joint capsule. So that's another thing that supports it. So x-rays will help support a diagnosis of a cranial cruciate ligament, but the big thing is it does rule out other things, unfortunately.
Yeah.
You could have things like bone cancer, I've seen that a couple times, infection, things like that. So it helps rule out big scary problems, and it also supports your diagnosis of the cruciate ligament. And if I'm not strong enough to do a drawer or tibial stuff, or even like on big dogs, I mean, maybe, you know, I mean.
Yeah, I mean, you know, dogs are pretty tough, especially if they're weight. And they're going to harden themselves, and all those muscles are just going to tense up and not allow you to actually get that cranial draw or that cranial tibial trough.
Yeah, a lot of times if I can feel like a, you know, oh yeah, this is definitely an ACL injury or a CCL injury, I'll wait until they're under anesthesia and then I'll do my x-rays, because for TBLO you do have to take x-rays to be able to make the measurements to be able to do the procedure. I'll wait for them to be under anesthesia and just do the x-rays then, so you can position it, because they're not going to stand still for us doing a, you know, the x-ray view that we need to. And that way it's just one episode of anesthesia. You don't have to sedate them, wake them up, then put them back under. Unless, like I said, if I can't feel it, I can't feel it.
Yeah,
you know,
you just can't.
So that's
And
my
I mean, how many knees have you gone in that you thought was a knee and it ended up not being a knee?
Yeah.
1,000. So, you know, I think, you know, partially torn CCLs kind of need to go to surgery. That's probably the best bet, as long as they're good surgical candidates. And you know, you should probably go beforehand, not just wait on it.
Yeah, I can't fix arthritis. I'd be a very rich woman if I could.
I can make arthritis function, or dogs with arthritis function a little better and help with pain, but there's not a whole lot that we can do to actually cure it. And this is one of the things that I feel like we cure. You know, with surgery.
Oh yeah, it's a done deal.
Yeah, absolutely. So, all right, so move on. Oh, now we have one of my favorite subjects.
Oh.
For dogs with IBDD, and IBDD stands for intervertebral disc disease, or neurological issues, do I have to get an MRI done, or would a CT scan show what is needed to make an accurate diagnosis? Well, diagnosis is your thing, so.
Diagnosis, my things that I send to you. Okay.
Exactly.
So, all right. So the big difference between a CT and an MRI is what that modality is good at, what you're looking at, right?
Yeah.
So a CT is really good for bone, and MRI is really good for soft tissue. With IBDD, a lot of times you're dealing with a degenerative disc. Okay, so if you think of the disc like a jelly donut, I love this.
Yeah, I love this analogy too. I really like jelly donuts. Jelly donuts are kind of good.
Can you bring more donuts one day?
I was thinking about getting them this morning, but you didn't hear all the stuff that happened to me this morning.
I heard part of it, then I heard you.
I laughed and I said, oh no, I need camera batteries and my charger for my camera, because my camera was like, had a little tiny one little bar, or it was going to die, and all the batteries were at home. So I turned around and I went home, and the batteries weren't at home, they were here at work. But once I got to work, I realized that I did not have my power cord for my computer, which I obviously need right now, because that's what we're on this live stream with. So I had to go back home and get that. Yeah, my commute to work was just weird and almost stressful.
Hot mess.
Yeah. One of those hot messes.
So yeah, so jelly donut. So you think that just because a jelly donut, you have the outer portion, which would be your annulus, right?
Yeah.
And it looks like the outside of the jelly donut. The inside is going to be your nucleus, and that's normally gelatinous, like a jelly donut.
Yes.
The problem that you run into is in dogs that have IBDD, that center portion actually starts to mineralize and it gets harder, right? So, then with normal, once again, normal activity on an abnormal disc starts to actually force that mineralized disc material, right? Because it's no longer gelatinous and, you know, squishy.
Yeah.
It starts actually pushing up on the outside portion, and it gets to the point where that inner portion actually extrudes through the annulus and it starts pushing on the spinal cord.
Kind of like stepping on a jelly donut.
Okay. So, but with that, the disc is mineralized too, which is what bone is made of. So a lot of times.
Like a stale jelly donut.
Oh my god. That's what I live with on a daily basis. Yeah. So, a lot of times you can see discs on a CT. All right. So an MRI, if I'm worried about like a tumor or something associated with the cord itself, which would be more soft tissue than an MRI. If I'm worried about a herniated disc, a CT would be kind of my choice, and it's a lot faster. You're talking, what, a couple minutes versus an hour. So a lot of times CT can be done under sedation. So you get your answer, you know, within a couple minutes. The other thing is, if for some reason you do a scan and you don't necessarily see something, you can always do a myelogram with a CT.
Yeah.
What a myelogram is you actually inject contrast material into the spinal canal, and it'll highlight if there's anything pushing on there. So once again, that'll show up really brightly on the CT. So like I said, I like a CT just because of the ease, the speed, and there's few instances where I'm not super happy with what I can see.
A lot of people have asked me about that, you know, and why we even need to do those diagnostics. You know, why, if IVDD is the most common thing, can't you just go in there and do surgery?
It's a lot of
And
discs.
there's a lot of discs out there, so, you know, neurologic examination can help localize it to a few disc bases, but do you want to go in and explore back? No, right?
Yeah, and also on x-rays, sometimes you can have chronic discs, and
Yeah.
they're the ones that'll show up, but they might not necessarily be
the one
the ones
causing
that are causing
paresis
the
or
problem.
paralysis,
Yeah, and to me, if I'm gonna go in there and start drilling away the side of the spinal column, I wanna know for sure
Where you should go.
where I should go.
You need a map.
Yep.
Yeah, and that's what the CT, I think.
And I'm a chick, so I'm fine with stopping and asking for directions.
Yeah.
And
We don't ever do that anymore, though. None of us do.
I
We
do.
just use our phones.
I can't
Hey,
see
tell us.
CTE, maybe
Oh, wait,
you.
wait, that's-
No.
Who's watching the live stream show? No questions. That was 32 minutes ago. I'm sure you figured it out, Mike.
It's the hospital director, too. Did I mention it's
Yeah.
the hospital director?
Yeah.
It's fine.
All right. I think that answers
I
that
think that
question.
answered that one.
Yeah, so we have one more question.
Oh,
And we have just enough time maybe to answer that one. My geriatric Labrador Retriever, 13, I can't really read.
we
13
just
years
found him
old,
walking on the side of the road and we hired him.
has osteoarthritis and does poorly under anesthesia.
Uh-oh.
Yeah, doesn't sound good. Are there any treatments that you both recommend to help him live comfortably and continue to be mobile for the remainder of his life? I'm especially concerned about long-term safety and efficacy.
What?
Does that work?
Efficacy.
See, I can't really talk. Hey, I had a speech impediment all my life. Now you're making fun of it.
I am
Sorry.
not. I'm making fun of the fact that you were just like,
Oh,
I didn't
she makes fun of me. I was just trailing off.
You make fun of me all the time.
That's sad. I do, it's true.
Okay, I'm sorry.
I'm smart in other ways.
I didn't
And
mean
dumber in others.
I didn't mean to make fun of you. It was not directed at you.
Just-
Okay,
I-
alright.
What do you get? What do you got? I got lots of stuff.
You have lots of stuff. This
I
is
do.
probably more a you thing. For a me thing, if I have a dog that we're gonna say treat something medically, I'm all about the pain management
Yeah.
side of things. And if we know that we're going to be doing something long term, that also goes into my little satchel of ideas.
Yeah.
So that I can
So-
pull stuff out. But then I send them to Robbie.
A lot of the time I get a lot of dogs referred for like general osteoarthritis. There isn't like a real specific place where anybody really thinks that it's bad or not, but there usually is. You can have arthritis in elbows, knees, hips, shoulders, back, and all those things kind of need to be kind of dealt with on some level. Now, and the whole process of osteoarthritis is, you know, it hurts to move, right? So the dog stops moving. What happens when they stop moving? They atrophy muscle. Their joints get even more stiff. They develop even more arthritis. So we have to go ahead and try to build that muscle up. But if we do that without pain management, it's kind of cruel. And without knowing exactly where it hurts specifically
What type of pain?
and what kind of pain, then we may not even know what kind of medications we need to, you know, give that animal. So, you know, a good physical exam by her usually helps us narrow down, you know, where that pain really is. Many dogs, or at least lately, I've seen a lot of lumbosacral stenosis dogs. You know, where they may have had knee
People are
issues.
becoming more
Yeah, I
in
think
tune.
exactly. They're becoming more in tune with the older dog that's like 13, 14, 15 years old. And, you know, we find lumbosacral stenosis, it's arthritis in the base of the spine. And we actually can do a lot for that. One, we can do rehab. And rehab usually consists of, you know, floor exercises called through positive reinforcement, which helps me target specific movements and limitations that that dog has and help them become stronger at those things. But we also can do underwater treadmill where it can unload or offload that 40% of that dog's weight. So it becomes a lot easier for them to move around in there to build muscle. We can use laser therapy to help with that pain control. But also, you know, we can go to Dina and go, hey, look, this dog hurts. And she has a bombardment of pain medications that she can use, as well as something that we do pretty routinely is epidurals. And so on those lumbosacral stenosis dogs, we can directly inject steroid in there and really reduce all the inflammation, help with that pain, and many of those dogs get immediately better. And we can repeat that even, you know, a few times a year if they're really needed, right?
Yeah.
Yeah.
The other thing I happen to think of is when we're talking about arthritis. You know who also suffers from arthritis? Cats.
Yep, that's true.
You know what the number one reason that, or the number one thing that you think of, or that cats will do to show that they're having issues with mobility?
Laying the sun.
What?
I might have heard that like years ago, like, you know, they want to heat their own joints up.
No, they stopped jumping.
Yeah, that's true. Functional limitation.
Functional limitations. So a lot of times, you know what I mean, with older.
Almost wow. That's how life is. It's pretty like I screw one thing up and like bunches of other things happen like right after another. I
Cats
think it
are
was
jumping.
yesterday.
Oh, there's
Yesterday, Melissa and I were both on that train
Oh, I believe this.
where she had hung a harness on the underwater treadmill. We didn't tell Mike this, but she had hung it on the
Everybody
inside of
else.
the door, and she closed the door and realized that she closed the harness in the door. And so, you know, water came up, and I'm writing records, and I'm looking behind me. I didn't notice it either, but we had like maybe 20 inches of water in there when it started pouring out.
Oh my God.
And you can't open the door, and you can't drain 20 inches of water very quickly. And so I had to kind of muscle the harness out of there. And, you know, last week, poor Melissa like overfilled the tank while Mike was here. She
The
felt horrible
funniest
about
thing
it.
was I have never seen Mike move that fast.
I know, right?
All of a sudden you hear, there's water
There's
everywhere.
water.
It was like marine superman. It was super
Yeah.
marine.
Yeah. Fortunately, we have lots of floor drains in there. You know,
And we have an awesome floor.
yeah, we do have an awesome floor. I would love to say I love this floor, and I do. I say it every single day. It's amazing. It looks like concrete, but it's not. It's this wonderful rubber. It's the only thing that I find a little annoying about it is that when anything like wet falls on it, it won't absorb it at all.
Oh, no, well, that's also
And
good.
so you have to, yeah, I mean, it is a good thing because it
It
keeps all the
doesn't
bacteria and
absorb
stuff out.
Yeah, exactly. It's,
You know, no
cool.
smell, no nothing. So, but you do have to kind of go behind it and wipe up that water or wait like
Clean
an
it back
hour
for yourself?
for it to evaporate. Yeah.
Oh,
Yeah.
poor baby.
I know, right? Hey, 10 viewers. We went from 8 to 10 just then. It's the banter.
It truly is. It's me making fun of you.
Yeah, it is. Wait. It's me making fun of her. No, that never happened.
That's not, no.
Well,
So cats, yeah, litter boxes too.
litter boxes. What do you do about litter
Like you know how you get like the different
Oh,
heights of the
yeah.
litter boxes? So like all of a sudden your cat, yes, that is one of the,
Yeah. I see 4 cats a year.
and I
And I
said
just
to
got
you,
one there.
whenever we talk about serious stuff.
I know, yeah,
Yeah.
it's serious stuff.
But anyway,
Yeah, so, you know, cats can benefit now to go through a
I
lot
think
of
it's
different pain medications.
the fun,
I mean,
yeah,
even
it's
10
getting
years
better.
ago,
It's
right?
not a great array that we can use, but I do find it fun to watch the cats in rehab, and I'm still waiting for people to know where to go.
Yeah, I just don't like to torture them that much unless
What if they
they
like it?
absolutely need it.
What if they like it?
And if they're a really easygoing cat, absolutely. You know, many times, I mean, you can change a cat's environment. I mean, really, I really do love cats. I love having them as patients because they kind of challenge me, you know.
The kitten was awesome.
Yeah, they really challenge my creativity to try to find and, you know, change their environment to make it more therapeutic. You know, I mean, that's really what I do for a living. I just create an optimal healing environment. And that's what I love to do with cats.
Remember that kitten that we had? It was a while ago. Oh, it was the little,
Yeah, a
my
really bad
strong
food
hand.
effect.
No, he hasn't come in yet. But no, the strong hand kitten that had the contracture. And he was like itty bitty, and like I came in one day and it looked like, you know, you remember the old game Mousetrap?
Mm-hmm.
It looked like that with chicken.
Yeah.
With chicken and foam pads. And this
Yeah.
kitten was just like, it would just hop up and like come out from in between stuff, and he had a blast.
Yeah.
And
we had that
you
thing
were
for
literally
once,
making
too, that was a
him.
kitten.
I remember that one too.
It was
You're
years
right,
ago,
You're right.
but-
You're right.
Yeah, I mean, like I put some cavaliers out and put these different pads and so forth, and then we were literally just throwing chicken all over the floor. He'd only go out over half or go to half of it. But I mean, he had a blast. We all loved watching him play. The owners really loved it too, and it was actually very therapeutic. And
It was a
that
lot of
one
fun.
really ended up
Yeah,
doing very
that's
well.
why I used to hide in rehab all the time.
Mm-hmm. Yeah, it's a pretty good job.
Stressed out and.
And yours is too. Rehab's pretty fun.
Rehab's fun.
That's good. Well, I think that wraps it up for tonight. But if you guys like this live stream, you should comment.
We had a lot of fun.
You know, I think you'd be able to rewatch it on our YouTube channel here. So go ahead and do that. We'll leave it up. Maybe we'll edit some of it and throw in some background B-roll to make it slightly more interesting, so you don't just have to look at us. Something like that. And we'll always be glad to do another one. Cool. Thanks for watching, everybody.
Did you just fall?
Yeah, I just jumped up. Did you fall? That's gonna be